In 1997, I was diagnosed with HIV. It wasn't a big surprise. I knew that I had risk factors. I'm a recovering injection drug user, so I knew, even during that time when I was using drugs, that there was some risk in doing that, and I shared needles, and so when I got ill and became sick, it wasn't a big surprise when the doctor suggested I take an HIV test, and it came back positive.
I was born positive. So tomorrow, actually, December 7th, I will be 33 years old. For me, that's something that I didn't even think would happen. A lot of us who were born HIV positive didn't even think that past our 5th birthday, past our 9th birthday, that we would even still be in existence. So for me, it's imperative that people understand and see that there are people who are still living with HIV who were born with it, because we're kind of the forgotten ones. People don't really hear about us.
I'm a Black woman fighting this struggle in the Muslim community. Doing this since 2008 when I was in college, started off in college. I met a friend who became positive, 19 years old. It really affected me. I realized ignorant about HIV and AIDS, and nothing about it. So I went to my college campus, started an AIDS Awareness Week, and then I went to a hospital to work there part-time and met a Muslim living with AIDS. And he was he had a lot of hurt, a lot of pain, and he told me he didn't feel welcome in his own community.
Brought into HIV work because I'm a Black gay man of a certain age who was living in New York City at the time of the outbreak in 1981. The original cases were people who I hung out with, who I knew. We thought we were in a short-term situation, a crisis, but short-term, it's certainly something would come along to resolve the issue, and it didn't.
We were confused, it didn't have a name, it was GRID, they changed to a number, and then we came to AIDS. So it's been a fight for me for a really long time, and it's important to me that my village is not destroyed by it.
The Black community was being impacted not just by HIV, but by substance use and mental health. And I couldn't figure out a better way to spend my energy, but to begin to figure out how do we create healthy communities. I knew we weren't broken. I knew we weren't bankrupt. I knew that we had talents in our community, and I wanted to be a part of the solution and not part of the problem.
HIV is a disease, but because of the conditions that facilitate and support the disease transmission acquisition, particularly in our communities, to me it's a human rights issue. If housing instability remains an issue, if income inequality remains an issue, if negative experiences engaging healthcare professionals remains an issue, if stigma, bias, and discrimination continue to permeate in our communities, those issues will exacerbate whatever the disease is.
One thing I think is important that folks should know about an epidemic, that it requires unconditional love. And through love, we have access to patience. Through love, we have access to coming together, right? Unconditional love that gives us access to intimacy. Into me, I see you, right? So if I'm seeing you as another individual, I'm clear that it is my duty to love you as I'm loving myself. And so what is it that you need, sibling, that I can give you?
Everyone is impacted by this issue. And if we don't make some changes, if we don't open our arms to everyone and say, let's work together, we're not going to see the changes that we need to see.
We have been in the HIV epidemic for about 35 years, 37 years, and we find ourselves in a place where we're making advances in many populations and many communities, but the Black community is still bearing the brunt of the epidemic, and particularly certain populations like Black gay men and Black women have the highest proportion among women as well. And so we need to figure out a way to stop that, frankly. And the only way we're going to do that is for us to come together, to convene, and to talk about why it is that we aren't making some of the same advances as other folks. What are the systemic problems? What are the internal problems? How are we communicating with each other? How do we use our history and our love for ourselves, for Black people, to build the movement that can get us beyond this epidemic?
We all need to come and realize what is the commonality of all of us coming together so that way we can combat this virus, we can get past this epidemic. And I think right now that as a unit, we can do that because we have everybody in the room right now. So that's the importance. I think that's what we can do.
And we often forget the grassroots efforts at the community level, and there are folks in our communities that are doing really good work that we could potentially learn a thing or two from that will get us closer to ending the epidemic.
We actually have to all roll up our sleeves and do the work. I think if we come together and we learn from our past mistakes, we learn from our shortcomings where we've started efforts to end the epidemic and we've talked about what needs to be done, but we haven't actually implemented any change, I think we'll have success.
Our goal is to reach a day where there's not one person who dies of HIV or who is diagnosed with HIV, because it doesn't exist. And that's what our work has to be so clearly about. Ending the epidemic is just one phase in that.
I feel like we need to be clear about being unapologetic about our survival and the fact that we matter. We deserve to be here, our lives matter, and proving that is more than a document or a grant or meeting a deliverable. It's actually standing in the face of people and saying that we are here and we're not going anywhere.
Emil Wilbekin is the founder of Native Son, which is a platform created to inspire and empower Black gay men. Mr. Wilbekin has an expertise in editorial creation, content curation, and multimedia storytelling, and has served as Chief Content Officer at Afropunk, Editor-at-Large at Essence, Editorial Director and Vice President of Vibe Ventures, and Editor-in-Chief of Vibe Magazine. He holds a BS in Mass Media Arts from Hampton University and an MS in Journalism from Columbia University. Mr. Wilbekin resides in New York City and is HIV positive. Please welcome Mr. Emil Wilbekin.
Welcome to the first episode of United We Rise, Every Black Body Live series. I'm Emil Wilbekin, founder of Native Son, a platform created to inspire and empower Black gay men. I'm honored to be your host to kick off the launch of this amazing national collective called United We Rise. United We Rise is a new Black-led initiative that aims to mobilize the Black community to end HIV. We're going to discuss how this new effort came together and what it plans to do. And we'll talk about how it fits into the current moment in America. Joining us today are members of United We Rise. Please welcome Deborah Levine, National Secretary of National Black Women's HIV/AIDS Network, and Gary Daffin, the Executive Director of the Multicultural AIDS Coalition. Thank you, Gary and Deborah, for joining us tonight to help our viewers understand United We Rise is all about.
Thank you. Thanks for joining us.
Thank you. Thanks for having us.
No, thanks for having me. So before we do that, can you each tell us a little bit about yourself? And Deborah, we'll start with you first.
Sure. So again, my name is Deborah Levine. I'm the National Secretary for the National Black Women's HIV/AIDS Network. I'm also the Director of the Harlem Health Initiative for City University School of Public Health and Health Policy. By trade, I'm a psychiatric social worker and have been doing public health all of my career. I live in New York, and I get to share my wonderful city with our host here, and I'm just glad to be here and glad to share our story today.
Thank you. Gary, tell us a little bit about yourself.
Sure. So I live in Boston, where it's not cold yet, but certainly will be sometime soon. I'm originally from Alabama, but I've been here for a few decades now. I'm the executive director at the Multicultural AIDS Coalition, which has been around since 1989. And we do prevention and care work. We also do capacity building, technical assistance, and community organizing. And we focus on Black, gay men, Latinx communities, African and other immigrant communities, and women. So I've been doing HIV work in a volunteer way since about 1993, when I started a program with a friend of mine for Black gay men in Massachusetts, and have been at MAC since about 2000.
Okay. I'm so sorry about the technical difficulties, everybody. It's kind of a little sketchy, so please bear with us. This is our kind of brave new world, so just bear with us, and we're going to push through as we do.
Sounds good now.
Right.
Good. So United We Rise is a coalition, not an organization, correct?
Correct.
Okay. And so how did the three convening groups come together?
So the National Black Women's HIV/AIDS Network and the Black Gay Men's Coalition have been working together well over 10 years, really having made a decision that we wouldn't walk into a room without one another or speaking one another's issues. As Black people, we have some agenda items that are for the greater good. And as two organizations, we decided our greater good was to work together on these objectives. It's always been our dream to be able to convene Black leaders from across the country to talk about not just HIV, but the intersections, and to look at it from a holistic perspective. And so probably a little over a year and a half ago, that opportunity came to fruition, and we received some funding and asked MAC to come in and help with be the fiscal conduit and help us coordinate these efforts.
Wonderful. So Gary, who is supporting this work?
So we were able to get funding, as Deborah said, about a year and a half ago. Our major funders are Gilead Sciences and Beep Healthcare, who really stepped up to the table and have supported us through the transition from, originally we were going to have this in May, but then of course the pandemic happened and we had to extend it to the convening part of what we're doing is happening in December. But there's also been a lot of community engagement activities which we've been doing and will be doing between now and December, and then thinking about what happens after that. So they've been really, really supportive, and we got a little bit of early money as well from Broadway Cares, Equity Fights AIDS, and the city of Houston was one of our partners in the beginning because we were going to have the live meeting there, but that changed, obviously.
Right. So go ahead, Deborah.
I was just going to say, and also thank you to the planning body members who came into this with the idea that they were going to do a couple of meetings and help guide a process, and a year later have stuck through meetings and supporting the work. If we could just take a second, I also want to acknowledge both from the coalition and the network. In this process, we lost Dr. Ron Simmons, who was a member, Dolores Dockery, who was a member of the network, and the chair, Barbara Joseph of the network. So this convening takes on even more of a special meaning as we move forward.
Well, I am most grateful that you both are doing this work. It is very, very important, particularly as we are, going from one pandemic and living in another one at the same time. Contrary to what some people may think, Black communities are very, very, very diverse. United is a part of your name, and everybody is in the tagline. Can you talk about how we should interpret every Black body? It seems like a spin on everybody.
Sure. So, United We Rise was a name that we came to collectively, and basically it emphasizes the fact that we all believe that as a unified community, as a unified Black people, we're much stronger and much more forceful, and will be much more effective in what we need to do. And particularly around HIV, it's time for us to recognize that when we say everybody, we mean everybody. We mean gay people, Black people, men, women, people born in the U.S., people born outside the U.S., people who inject drugs, people who are sex workers, everyone. And so we really wanted to try and put together a planning committee that reflected that diversity, and that brought new voices to the table. So to help us think about things that we may not have thought about, or we don't have, or the people who've been in the HIV field for a long time may not have a lot of experience in. And so that was why we came up with the term "every Black body." Every meaning everybody, everyone, all these different people. Black meaning Black people, and body meaning the group of us. But we called it every Black body because we could have just said everybody. We're going to end HIV for everybody. Yeah. But we put Black in the middle. That's sort of the way that Black Lives Matter is not all lives matter. Right. We want people to realize that we are focused on Black folks. And so everyone is everyone. Black is Black, the whole Black community. And body, we wanted to also emphasize the fact that we want folks to love their bodies. We want people to love their sexuality. We want to get rid of shame. We want to sort of really focus on being healthy, but make sure that we included an emphasis on sex and sexuality and gender identity, because that's a part of what makes life worth living.
Excellent. How did the planning committee get formed? I mean, you've been at the table, who's been at the table so far in developing United We Rise?
Yeah, well, it was a painful process in the beginning. Give me breath a little bit.
Really, it started with pencil and paper and literally putting categories down and thinking across the country, making sure that not only we had urban, but rural communities were represented, that we looked at all the intersections and made sure that we tried to touch every component that makes up our community. And we didn't want to leave anybody out. So we asked others to advise us, to make sure. We reached out to people who are in different parts of our country to make sure that we had the voices of community that were represented.
I think that's excellent, because so often, you think about, I love that you said the rural communities, because I think a lot of us live in big cities and we take it for granted about the margins that get forgotten so often. So I thank you all for being so inclusive. Let's talk a little bit about the challenges that we're facing with HIV. According to the CDC, Black people are most affected by HIV in nearly every category. Black men have the highest, women, transgender people, youth. What are some of the reasons that you believe that Black people are hit harder than any other group, especially in this day and age?
Yeah. When you look at the fact that there's about 1.2 million people in the country who are living with HIV, and 40% of them are Black, and there are about 37,000 new infections each year, and 42% were Black last year. And that's been consistent for about the past 10 years. And that's part of the reason we came together, because we've been stuck in a way in this epidemic. We've sort of plateaued. We haven't been able to get below a certain level. And it's because, we have access to medications that work. We have access to, in many places, there's insurance to pay for people to get access to medication. But we still have the big social determinants of health that prevent people from accessing care. And that includes race. It includes systemic racism that prevents people from wanting to or fearing accessing care, not feeling like their doctors are going to, or the system is going to work for them, or afraid of the stigma of being identified as having HIV. Or there may be another issue like, they are people who inject drugs, and there's an issue of the criminal justice system. There may be people who are undocumented, and so they are worried about if they access healthcare, they may be deported, or they may get into other kinds of legal trouble. And so there are all of these systems and all of these bigger picture issues that prevent people from getting getting into care.
Are we doing riskier things, or are there other factors?
Absolutely not. I wish I could say to you we were having more sex or wilder sex. No, that is a myth that the media continues to portray. Again, I think Gary talked about structural racism, institutional racism. It is the way in which media talks to us about how we see ourselves and how others view us. So it is all of those factors that are at play.
Yeah, I think it's important for people to understand that being Black does not necessarily, the fact of your being Black, your race is not the reason you're at risk. The reason you're at risk is because we in the beginning didn't understand or weren't told that this epidemic was affecting Black people as well. And so it got a foothold in the community. And so we have a higher prevalence, and people didn't get into treatment, and people who are in treatment and, fairly suppressed can't transmit the virus. But if people don't know they have HIV, then they can transmit the virus. And so we, of course, most communities, Black people tend to have sex with Black people, white people tend to have sex with white people. And so when you have a larger prevalence of HIV, it's just more likely that you're going to come in contact with someone with HIV. And because of the determinants of health, it's more likely that they haven't gotten into care and they don't have viral suppression. And so you're going to be more at risk. But when it comes to the things that we do, studies show that people do try to protect themselves, and we are not having more sex. We're not having any riskier sex. We're not doing more drugs. None of those things. So it's really the environmental factors that are driving the epidemic in our community.
Wow. Well, I never thought about it that way. So thank you both for enlightening us all, because we listen to all the news and the reports, and it kind of paints us, animalistic and all these other things. And
racial injustice.
Thank you. Speaking of racial injustice, we are at a critical time in our country, from ongoing community unrest about systemic racism and police brutality, to Karen gone wild, to economic reform and questionable, and I will underscore questionable, leadership in response to the national pandemic. I want to ask you, especially after last night, how are you processing it all?
Remembering to exhale, and then reminding myself that I do have the power as an individual who is part of an organization, who is part of a process, who can continue to educate and get the word out and mobilize folks to finish their census, to make sure that they are registered to vote, that if we have to, even in the time of COVID, figure out ways to get people to voting places, to make sure that they are in, then that is what last night reinforced for me.
Right. I think when we first started this process back in October of 2019, I think, the first meeting we had 3 planning meetings throughout the year, but at the very first meeting and throughout the whole process, the group of people we brought together, they from the beginning were saying, we need to talk about not just HIV, we need to talk about the fact that there's systemic racism, the fact that we have social and political determinants of health that are driving this epidemic more than anything else. And we need to also look at the fact that we need to have conversations within ourselves, within the Black community, and talk about the ways that we don't communicate, the ways that we stigmatize each other, and the ways that we harm each other. And if we can heal that, and we can come together as a group, as we said, united we rise, we could be a very powerful force. And so, all of this was before George Floyd, before the pandemic. And so there was really, I think, just something in the community, in the air, in the water, in the zeitgeist. And so it was a very easy, we sort of smoothly rolled into shifting our work into the context that we have now, because there's an opportunity for us to work within those larger movements, to both embrace them and integrate HIV into them in some ways, and sort of make our HIV movement stronger by recognizing that racism is an epidemic as much as HIV is.
to Gary's point, even though that this was supposed to be a short planning process, what has really evolved out of it is organizations that typically had not talked to one another before, maybe not had known one another before, individuals who are doing this work in very different sort of ways now had an opportunity not just to meet for those 3 meetings, but to really begin to develop relationships. And from that, we have actually seen growth in terms of webinars that don't just address HIV, but look all the ways across the spectrum, looking at police brutality to talking about clinical trials, and using our expertise as HIV providers to really help guide the conversation around COVID.
I love that. I love that. How has particularly the social unrest and the racial equity protests, has that hurt the HIV movement, or are there any benefits that you can see?
I think there are enormous benefits. I mean, as Deborah was saying, we're beginning to have conversations across movements and across communities. And so again, when you look at other health challenges that we have, when you look at other just life challenges that Black people have, a lot of the root causes are the same. And we're never going to get off that plateau of having 37,000 new infections unless we deal with structural racism, unless we deal with how systems work, how healthcare systems work, how HIV systems work. I think HIV system does better than most, but still we have to sort of look at it and say, how is this working for Black people or not working for Black people? And sort of the overarching theme of our convening and our activity over hopefully the next few years is, what would it look like if Black people were leading the HIV movement? If the response to HIV was led by Black people, and I think that's a question that we can't just say, oh, it's great. It would be great. I think we had to. Part of what we're doing is talking to each other and saying, well, what do we need to do to figure out what leadership looks like in this context of the world is recognizing that racism is a pandemic itself, and how are we a part of changing the very nature of how the country works?
That's right. So we talk about racism as a pandemic, and I use this analogy all the time. COVID-19. We're already living in the HIV pandemic, and then here comes COVID-19 on top of the racism. Like, do we see the same type of disparities on how the two pandemics are affecting our communities? What are the similarities?
Definitely. People were surprised, maybe outside of the HIV world, that Black and brown people were going to be disproportionately impacted. We have a sort of saying, when others sneeze, we die. Right. So I don't think the HIV community was shocked or wasn't aware that there are disparities that impact Black and brown people. I think what this also offered us was an opportunity as HIV providers and health educators to be able to use our skills to be able to not only talk about HIV and prevention, but to then talk about COVID as it relates to that. So being able to use our health educators, the systems that we already had in place in terms of communicating difficult information was already there. That's why the HIV providers are key for me, in a lot of ways, dealing with COVID and really bringing that forward through this convening, because that now has become one of the conversations that we have to have.
Yeah, I think that, obviously we saw in COVID what we see in HIV, and that vulnerable communities are going to be at the head of the pack when it comes to being affected by a pandemic. The same sort of economic challenges that people with HIV face, we saw that poor communities were affected by COVID immediately. But I also think that it also shone a light on some of the communities that were most affected by COVID, like immigrant communities. We don't necessarily pay enough attention to in the HIV movement either. And because there are lots of challenges for people accessing services in the system, I know here in Massachusetts, we saw immigrant communities really hard hit, and we saw those communities rising up and figuring out ways to support themselves and help themselves. And I think we need to go back to not to the drawing board, but go back to the ground and figure out how do we invest in local folks and local leaders, community leaders, to help us figure out how do we effectively change the course of HIV? How are we going to effectively talk about the COVID vaccine and get people to be able to trust that it's something that they should utilize? So I think we see a lot of similarities. The one big difference is that COVID is, of course, much more infectious than HIV in terms of the ease of transmissibility. And that poses an enormous challenge, of course.
So I know a lot of members of the Native Son community and just across the country, people with HIV were terrified when the pandemic really hit. Do we know if there's greater impact on people with HIV or less impact?
From COVID-19?
COVID-19, I'm sorry, yeah.
I mean, there haven't been studies that have shown I'm not a scientist as a consumer of this information, that have shown any adverse impact on people with HIV who are virally suppressed. They haven't had any worse outcomes. I think the issue is that people who are vulnerable to acquisition of HIV are going to be in positions where they're much more vulnerable to acquisition of COVID. And conversely, the COVID pandemic has shut down access to services to many people, including people with HIV who may not be able to, to get to their medications or get to their usual support services, which are equally important. And so they also may not have access to condoms, and they may be coping with the overall mental health challenge that COVID-19 has presented. And so we're going to have a lot more people taking risk, and we're probably going to see an increase in the HIV acquisition as a result of the lockdown and the sort of the impact of COVID. So the two certainly are impacting each other in terms of the medical. From what I've read, there's not any extra additional impact on people with HIV who are healthy.
Your website posts the question of what would the response to HIV look like if it was led by Black people? Do you have any questions? Do you have any answers to that question?
So I would think for me that, and for I think the network, it would be that services would be culturally competent, linguistically sensitive, which would be better services for everyone. Because if you improve the overall services so that they are doing what they are supposed to do, then everybody benefits. I think because of who we are and where we have come, because of our history, we are people who are not broken, we are not bankrupt, and we have the talent and the resources in our community to be able to make the change. So yeah. I think it would benefit us all.
Yeah. Very
Well, I think we don't know the answer to the question. That's our endeavor. But I think a lot of what Deborah is saying, that came up in our planning committee meetings as well. People wanted to talk about what resources do we have, instead of having sort of a deficit model approach to it, sort of how we do this, sort of looking at what are our strengths and how do we as a community, what resources do we have, what innate skills and knowledge do we have that we need to bring to bear on this epidemic? How do we look at our history and how we have survived and how we have thrived and how we have been resilient, and rethink how we would construct a system to work for our people? And that's the variety of our people. Our people are, there's lots of different Black communities, and there's something that all of us can bring together and talk about, how we in our unique ways can contribute to something that, makes life and health better for every Black body.
Right. And make sure that we're bringing seats to the table so that we have new leaders that are coming, fresh ideas, and that we really push the envelope and not be apologetic about what we ask for.
Yeah. And one of the things I do want to get in is like when we have the planning committee, but we also we engage the community. Like early on, we used this process called the Delphi survey. We came up with questions that we put out into the community to ask them what they thought would be important, and then we as a body went through those and sort of prioritized and systematized them and ended up with 5 key categories that we're working on: Black leadership, Black organizations, policy, Black community engagement, and then intersectionality and gender and sexual identity. So those are the 5 key areas that we're sort of focusing on. And I think those are good for HIV. I think those are good things for us to talk about in terms of COVID response as well. So the planning committee has done such fantastic work in thinking through where we are and how do we move forward, that it's been a great group to work with.
So I wanted to throw this question at you both. What do you think about the talk of, HIV is now no longer a white disease because of medication and PrEP and so forth, and that the money is now no longer focused on HIV, so it's harder for Black communities and for Black people to make any kind of way forward? How do you respond to that?
Well, HIV was never a white disease. We always had HIV from the very beginning. It was just discovered and first identified among gay people, and then of course all the stigma stuff shifted into gear. So I think there is money in the system for HIV care in those places that are willing to provide it, and people in states that have Medicaid. If people are in the Ryan White program, for example, they do well. The problem is that we aren't accessing those services, and the system's not set up for us to take advantage of them. And it is true that there's not the same sort of funding for the wider range. What has happened is that the government, what funding has narrowed. It used to be like we fund all these things to help people die, basically, in the early days. There were all these sort of, not necessarily directly medically related or service related, but over time that has been narrowed and narrowed and narrowed. And so in order to access government money, you have to be pretty tight and run a more clinical approach to things. So that I think maybe where some of the community organizations are no longer or haven't been able to make that shift. So we've got to think of new ways, and we've got to figure out new ways to support our programming, new ways to collaborate, and talk about where's the money going, and is it proportionately going to the people and the places that need it most? And so in that case, yes, we need to make sure that the money follows the epidemic and the numbers and the people.
But that also raises another opportunity for individuals to be able to help support their local Black organizations who do this work. The smaller organizations have a harder time competing against the larger organizations, and funding can change every couple of years, and you have got to be able to spin on a dime to be able to achieve that. So as individuals, we can also support those organizations in our community through donations, through volunteering. Those all become valuable resources to our organizations, and supporting things and working with them. So, that's another way to help.
Wonderful. So what's next for United We Rise? What can we expect?
So we have a few more episodes talking about the work. We'll be engaging on Twitter, on Facebook, on Instagram. You'll see that there will be more information on our website. And then our convening will be in December. So we are really excited.
Yeah, I think this originally started out as we were going to have a conference, but that became something else. We wanted to look at this as a longer term initiative. And so between now and December, as Deborah said, we're going to have weekly engagement with people, having people try to interact with us, and have different people from the planning committee and different people from the community engage. And then the convening itself is we're inviting a diverse group of people
250 people to think about, what is next? How is it that we look at these 5 key areas and figure out what does a strategic plan look like? Like, what is it? Is this a movement? Is this an initiative? What is it that we want to do? So we're in the process of creating this initiative, and we want people to give us their feedback and join us. We're not starting an organization. This is not an organization. This is we're kind of trying to hold the space so that people can come together and figure out how do we unite and how do we mobilize, and what is the best way for us to do that. And so we're trying to do this a little bit differently, and not be hierarchical, not be so focused on we're trying to run a program per se. Really think critically about what does Black leadership look like? How do we engage the community? How do we have hard conversations? Now we talk about intersectionality. How do we have hard conversations about the fact that there's homophobia and transphobia, sexism, internalized racism? There are all these things that we have to deal with. That if we can't get past those and we can't talk about how we hurt ourselves in our own communities, we can't expect to get past this epidemic. And so that's what's different here, is that it's not a think tank, it's a community space, an ongoing community space, ongoing strategically thinking about what makes sense for our community.
So my last question is, how else can people help with the mission of United We Rise?
So in the short term, you can follow us on Instagram and Twitter and Facebook. You can engage with us through these episodes that we'll be doing. You can leave us messages on our website, and just reach out to us, and you can reach out to us.
Mm-hmm. Yeah, I want people to give us their
Mac.
Sorry, go ahead. I was just going to say, we want people to give us, as they interact with us on the website, send us a note, send us information if they have ideas about. We're going to try to figure out ways to actually get people's input in terms of those categories that we talked about: Black leadership and Black organizations, intersectionality. How do we have these hard conversations? Because we're having them in this space, but ideally they're going to be happening in local communities. Us having them at our meetings is not the be all and end all. The idea is, how do we create a space? How do we come up with ideas and solutions? And how do those get replicated? And how do those conversations happen in other places? And obviously, social media and the virtual world, which we're going to be in for a while, is going to be a place where that happens. And so I think we want to try and engage people who've been in the work, people who haven't been in work, people who are in different places, different work, different kinds of movements, create some cross-pollination and engage with each other.
Some of those models that work and models that we know work.
I love it because it's very intentionally intersectional and intentionally Pan-African. And I love that. I love that. So Deborah, I know I said last question, but moderator. Sure. In what ways can people help smaller organizations?
Wow, you could donate money. That's always acceptable and always willing, and no amount is too small. You can volunteer. You can help coordinate events that raise awareness around the organization. You can give when organizations are doing community events. I know we're in a virtual world right now, but believe it or not, there are food pantries that are going on. There are clothing drives for people that are coming out of the hospital that still need clothes. And so there are lots of ways. You can also volunteer your time as a board member. Learn how to help an organization if you have a specific skill set. Small organizations, they're hard to attract people with that are, lawyers and bankers and media folks and influencers. So take a look around your community. I'm sure that there is a organization that could benefit from your talents and from your wealth.
I love that. I love that. Any closing thoughts?
This was fun. Thank you for joining us.
I know I'm supposed to say, join us. You know, we rise, every Black body. But most of all, on behalf of the network, we thank you. We thank you for allowing us to be a part of this process, to watch the outgrowth, and to remind folks to remember to exhale so that you can inhale.
I love that. Well, thank you, Gary and Deborah, for joining us today. If you missed the video from some of the members of United We Rise, which played before I came on, I encourage you to watch it. Please follow them at Every Black Body on Twitter, IG, and YouTube, and go to their website, everyblackbody.org. Share it in the comments what other topics you'd like us, and us meaning United We Rise, to discuss in our upcoming episode.
You had us right. You're now part of the family.
I'm grateful to be a part of this, especially as a Black man living with HIV and, you know, creating this movement, Native Son, and knowing that many of our followers and our community are HIV positive. So I am most grateful that you created United We Rise.
Wow, thank you.
Thank you.